Good morning, everyone, and welcome to yet another interesting and intellectually stimulating seminar. Today we have a distinguished scholar, and we are looking at another dimension of migration as well as globalization, because migration is not limited to your environment, to where you are currently located. It is both internal and external. It is also about, it is a global event. And as such, today, the head of psychiatric department and at the Ben Carson Medical School and Hospital at Babcock University, Dr. Mrs. Fasesson, will be speaking to us about migration in another dimension. The title of our paper is Contextualizing Psychiatry and Migration. I don't know how many of you have heard about Yaba Akosi. Akpa means and, Osi means left for the non-Yoruba speaking and non-local of Yaba in Lagos. There is a major psychiatric hospital that has a long history, and we often say, derogatorily to people, you must have been to Yaba Akosi. In other words, you are crazy, you are mad, and whatever. But of course, that is not what Dr. Fasesson is talking about today. She's going to enlighten us about the fact that our focus in this center is multidimensional, it's multidisciplinary, and as such, we can learn from the medical sciences. I hope the science folks are here, both the former dean and the current dean of Faculty of Science, and our colleagues in the sciences, and also those in the health sciences, they also join us. Indeed, Dr. Aneto, you probably want to call them, they should join. And then again, it will be a learning moment for all of us, so that they see that when we say Center of Excellence in Migration and Global Studies, it's not limited to folks in my department or in my faculty, which is either the social sciences, depending on where you put us, or in the humanities or in arts. It is all about us. It is global. It is universal. And without much ado, I'd like to welcome Dr. Fasesson and thank you, Ma, for sharing your intellectual property with us. You have 35 minutes to present, or 40. I can see you smiling. Okay, 40. Let's do 40. I usually like to make my mothers very comfortable. I lost my biological. Today is what? 19th? Yes, yesterday was the seventh year that she passed on. So thank you very much, Doc, and you have the virtual space now to speak to us. Go ahead.
Good morning, everyone. Can we all see my slides? Hello?
Yes, we can see it. We can. Okay, they can hear you. I mute all of them.
Yes, sir. So thank you very much. Thank you, Professor, for inviting me today. Thank you, Ms. Aneto, too, for inviting me today. So today we'll be talking about the topic, contextualizing psychiatry and my. Okay. Oh, this is my outline. So by way of introduction, we all know that migration is an ongoing process and it has been from antiquity. It's something that has been ongoing for a long time.
Doc,
yes.
Can you show it as a slide so that they can see the whole thing?
Okay.
Just go to
okay.
slideshow. There you go. Yes.
All right, sir.
Thank you, ma'am.
So it's an ongoing phenomenon, an ongoing process that people move from one continent to another. People will move from one part of a nation to another. People move regionally too. And it's a it's an experience that we can say is normative, is normal nowadays, not with the issue of the brain drain that we're experiencing, and a lot of countries are relaxing their laws, thereby welcoming immigrants into their nation. With the continuous and dynamic demographic changes globally as a result of this worldwide migration and globalization, the need to fully understand how migrants feel, how they cope, how they adapt, how they are culturalized, their culturalization experience in the new host cultural environment without the adverse impact on mental health is timely and essential. It is very important that we are talking about this issue today, because a lot of people are migrating from one country to another, from one part of the country to another. All right, the demographic characteristics of present-day migrants speaks of the reality of this issue. And in 2013, the International Organization for Migration, they documented that 214 million people migrated. And this is about 40% increase in the number that migrated in 2000. That is 150 million people migrated in 2000, in the year 2000. That means 1 in every 13 person are migrants worldwide. So we are saying that 3.1% of the world's population migrate from one part of the world to another. All right. It was also documented in 2015 that 244 million people migrated. Out of this, in 2016, 22.5 million were discovered to be refugees. So it's actually a reality that a lot of people move from one country to another, from one part of the country to another. And as time goes on, we will understand that it's actually majorly the youth and also women that usually migrate from one part of the nation to another, or from one part of the world to another. So, so now, about 3.1% of the world's population migrate. So studies have shown that at least 1 in 3 people in the world migrated in 2013. And in the same 2013, a total 214 million people migrated worldwide. This is like 40% increase on the figure that migrated in 2000. Next slide, sir. Next slide.
Next slide, okay.
Yes, sir. Okay, now, what is migration? Migration is a process of population movement, either across an international border or within a country. When it's within a country, we say they are internal migrants. When it's across the border, we say they are international migrants. Migration can be defined as a process of social change that results in an individual moving from one cultural setting to another cultural setting, either for a permanent period of time or for a prolonged period of time. This extraordinary global process has brought about uncountable tremendous opportunities. So we can all agree that as people move, they move for better quality of life, they move to greener pastures to benefit from what the other economy can offer them. And also this is associated with a lot and unprecedented new challenges that they face. So from psychodynamic point of view, we can actually define migration to mean mourning. What is mourning? We all know what mourning is all about if you've ever been bereaved, when there's a loss of loved ones. So in migration, there is loss of contact with people. There is loss of contact with family. There is loss of contact with friends. And there's loss of contact with the culture where someone has grown up into, all right? And there's a tendency for the person to go into the future that is filled with a lot of insecurities. Money can actually be described to be simple if the person is able to adjust almost immediately to the loss, to the experience of being bereaved, one is able to adjust, and it can be complicated if the person is finding it difficult to adjust to the new status of maybe to the new status of widowhood, or for example, migration that we're talking about. If the person is not able to adjust to the new culture, to the new environment, to the new climate, weather, then it can be a complicated issue. And money can be extreme, the same way migration can be extreme when the person is finding it difficult to adjust to the new setting. So, which is described as an immigrant syndrome, which we can describe as chronic or multiple stress, or Ulysses syndrome. Well, the clinical picture of mourning that we all know about is the depressive state, when someone is depressed after losing someone, the anxious state, when there is tension, nervousness. It's actually good that we're talking about this one, the clinical picture of mourning, depressive state, when the person is sad, undue, low mood, is crying, guilt feelings, or when there is suicidal thoughts. Anxious state is when there is tension, nervousness, poor concentration, jitteriness, irritability, or insomnia. And somatization set, when the person starts having physical.
We lost your audio, Ma, again. Dr. Faseson, we lost your audio. We're having challenges in a location, which is Elation. Yes, Elation. Dr. Aneto, you want to take over, or you want me to continue presenting on our behalf? Well, again, without, while we're waiting on the audio, I think she's in and out, she's left again. She was talking about the varieties of migration in the context of our discipline, that is in the medical sciences, particularly psychiatry, and in the cognitive set. She also defined migration as a memory deficit, attention deficit, and physical and temporal disorientation. As I read this as a non-medical personnel and a great or an addict, quote unquote, on boundary or border force. Border Force is a regular program on GoTV, I believe. I begin to see some of these elements in terms of people trying to migrate either to New Zealand, either to US, or to all those areas that have been shown. Migration, according to Dr. Faseson, is often split into two categories. One, voluntary migration, and involuntary or forced migration. And I think that contextualization or categories fit into what we have adequately mentioned on this platform. Migration, according to her, can be classified as labor migrants, refugees, international students, sojourners, internally displaced persons. So Dr. Faseson is back, and then you can take it from this slide now. We understand the poor connectivity in Elation. So continue, Dr. Fash, if you can hear me. Let's see, I have to unmute her, I guess. Yes, I have to unmute her. I've asked you to unmute, ma.
Yes, sir. Thank you, sir. Okay, sir. So migration we can split migration into two categories: the voluntary migration, involuntary, or forced migration. The forced migration are the internally displaced people, or people that have to migrate because of war or unpleasant situation in their communities. So we can actually categorize migrants as labor migrants, that is those that move from maybe low and middle income countries, or some countries which have economic situations to buoyant situations, refugees, international students or sojourners, or internally displaced people. All right, why do we migrate? We migrate to flee war, we migrate due to poverty, we migrate to pursue the dream of our life, we migrate to search for employment, we also seek refugee for humanitarian purposes, for educational reasons we migrate, and for political violence we migrate. Also, we migrate to gain more social independence, especially in women. For women, women migrate for social independence. All right, so the reason for migration can be divided into the push and pull factors. The push factors are the factors that encourages people to leave their fatherland, their motherland, their home country, their situation. And the pull factors are factors that pull them to this green, pleasant community, or where they feel they can thrive. So push factors drive migrants out of their country, while pull factor attracts them to a particular country. The process of migrating is actually stressful, and the stress can lead to mental illness and some other psychosocial problems. What are the pull factors? These are examples of pull factor: hunger, poverty, like we said, discrimination, and economic depression. Pull factors are opportunities that we can get in these other countries or in these other parts of a particular country. All right, study opportunities, family members too. For example, when a spouse had to relocate to join their husband or their wives wherever they are. All right, while there are many benefits of immigration, living in a new society presents enormous challenges, such as navigating social systems, government bureaucracy, new culture, languages. And let me give you an example here, or maybe I should wait. On languages, I have a friend, she relocated to US, and then one day she called me. She was fuming. She was very angry. And she said, though, that they said she has an accent. That, can you imagine, how can they say I have an accent? And I told her, I said, well, after she finished ranting, I told her, I said, well, you have an accent. She was angry with me. She attacked me immediately. And she said, oh, even you are stigmatizing me. I said, everybody has an accent. You are feeling stigmatized because you feel that you are lower. You are the one stigmatizing yourself. So languages, these are challenges that people face when they relocate from one part of the world to the other. Also, self-establishment. In order for them to be fully integrated into the system, they need to take up a job. They need to face new climate. They need to face new people, new boss, new culture. So this also poses some form of challenges to people that migrate from one place to another. Also, meeting basic needs, getting up a job, dehumanizing immigration processes. These are also pointers that can lead to psychological disorders for migrants. So migrants are a diverse group of people. Therefore, the relationship between an immigration is complex. There is often a decline in both physical and mental health for migrants over time. So studies have shown that migrants are actually healthy people. So they are healthy when you compare them to the host country. They are also a healthy group of people when you compare them to their native country. So this is what is termed as healthy migrant effect. But consequently, this effect appears to diminish over a period of time. The migrant becomes more assimilated into the host society. As they become more assimilated, there is deterioration in the health of the migrant, both physical health and also mental health. Next slide, sir.
Next slide.
Yes, sir. Okay, yes, sir. So the pattern, sorry about that.
This one?
No, yes. So the pattern of immigrants' mental well-being is actually different from that of healthy immigrant effect. But for the healthy immigrant effect, you will agree with me that for people that relocate to another country, they have to go through some assessments, medical checkups. So in order for them to be approved or be allowed to move in, they had to certify that their health status is optimal. Now, for mental health, nobody asks for mental health assessment for migrants. So the stages that mental health and the pattern of the mental well-being of immigrants goes through particularly 3 major phases. The first one is the euphoric phase, when the migrant is approved of the new status, when the migrant is given permission to relocate, when they are allowed to move and allowed to move into a new environment, they are happy. Their mental health is equal, even better than that of their host population. As time goes on, they become nostalgic because the reality dawns on them. They start facing challenges, language barrier, economic barrier, so many things. They start having issues. So along the line, their health status begins to deteriorate, and finally they adapt. As they adapt, their mental health now becomes almost equal to that of their native born, that is where they are coming from, or their native born that are also resident in the new country. So conclusively, we say that the longer the immigrants live in a host country, their health status begins to deteriorate. The decline has been attributed to many factors, the socioeconomic status. You will agree with me that as people migrate from one economic challenge community to another, they don't take up the status they left in their own country. There's a decline, which we call like a social drift. There's a decline, they take up jobs that are below what they were doing from the previous country. They scale down the social ladder. There's a drift down the social ladder. Some of them have to take up jobs that are not commensurate with their status. There is multiple responsibilities, communication difficulties. They have difficulty obtaining services in a timely manner due to language barriers, due to stigma, due to discrimination. They suffer all these things as they go to other countries. For example, access to health facilities becomes a problem to immigrants because they are newly settling. Due to stigma and discrimination, the health professionals may not even be able to, they may not be willing to render services to these immigrants as they move to this country. So how do we define health? Health is a state of complete physical, mental, and social well-being. And health does not mean that there is no disease or there is no infirmity. This definition is telling us that a situation where someone is living with one form of medical condition or psychiatric condition or the other does not mean that they are not healthy. It only means that they are living with this condition. As long as this condition can be controlled, is being treated, we can say that the person is healthy. So, but from this definition, we can see that mental health is an integral part of health. Without mental health, we cannot say that someone is completely healthy. So how do we define mental health? Mental health is an embodiment of social, emotional, and spiritual well-being. Before you say someone is completely mentally healthy, he must be socially healthy, he must be emotionally healthy, he must be spiritually healthy. Mental health refers to an individual's subjective feeling of well-being, of optimism and mastery. When the person is able to adapt and is able to bounce back when dealing with life issues and adversity, and the person is able to cope with life, simple or common life experiences, and this person is able to maintain meaningful relationships, is able to contribute positively to his community, to friends, to loved ones, to workmates around him. Next slide, sir. All right, so WHO defined mental health as our ability to cope with normal life stresses. WHO defined it as a state of well-being where an individual realizes his or her own potentials or abilities. An individual is able to cope with normal life stresses. An individual is able to work productively and fruitfully and is able to make contribution to his or her community. So in order for me to say I'm mentally healthy, it means that I know my limits. It means I'm able to cope with life adversities. It means I'm able to work productively and fruitfully. And it also means I'm able to contribute to my community. If we look at, next slide, sir. So if we look at the whole criteria, we will see that for us to perform work successfully, we should be able to go through and we should be able to function in all these domains. So what is mental illness? Mental illness is a disturbance of the mind and emotions. It is characterized by abnormalities of thoughts. It's characterized by abnormalities of cognitive process, sensory perception, belief, and behavior. But let me also tell us that in Nigeria, several years ago, about 4 years ago, the Minister of Health then said, and it's been established that as of then, 1 in 3 persons in Nigeria is living with one form of mental disorders or another. So there's an interplay of various factors in the etiology of mental illness: the genetic vulnerabilities, social and psychological factors. Genetic vulnerabilities, when there's a family history of mental illness, when there's a medical condition that can predispose an individual to having a mental illness. Social factors like unemployment, marital status, single status, divorce, and so many processes. Psychological factors also contribute to mental illness, which I'm also going to talk about as we go on. What are the common psychiatric disorders that we have? We have depression, which was actually predicted that by this year 2020, that depression will be the second leading cause of burden due to illness. And it's been established by even, you can agree with me that even in Nigeria now, we are facing a lot of psychological issues, economic problems here and there, so many things going on that is causing a lot of people to come down with depression. Also, the COVID that has been with us, because I won't say it's gone, the COVID that has been with us, even now, it's causing a lot of issues for people losing their job, their families losing people to COVID, so many things that can cause depression, anxiety, substance use disorders, borderline, bipolar affective disorders, schizophrenia, dementia, and eating disorders. The figures that you see, 60, 40 million, there are a number of people that are dealing with these psychiatric disorders in our time. What are signs and symptoms of psychiatric disorders? The common signs and symptoms that we have is speech problem, when the person is talking irrelevantly, incoherently. There can also be pressured speech. Mood problem, when the person is irritable, unduly irritable, or unduly elated, or the person is suppressed. Perceptual disturbances, like when someone sees things that other people cannot see, hearing voices that people cannot hear. Thought problem, when the stream of thoughts is pressured, or when the person starts having thoughts that people want to harm him, or thoughts of dying. Social relatedness, when people start having problems with interpersonal relationship. Agitation, cognitive impairment, when someone has problems remembering things, and intellectual problems. Now, let me mention it here that people with mental illness actually have deterioration in their cognitive function as time goes on. They become forgetful, they lose function of their IQ with time, if not well managed, all right? Now, migration and mental health. Migration is a social determinant of mental health. Migration contributes positively and negatively to the mental health of people as they cross the borders. Now, the process, people experience stress or psychological disturbances as they migrate. And the effects can start from the pre-migratory phase. As they are preparing, as they are putting things together, they start experiencing some form of stress. The situation surrounding their traveling can also predict or affect their mental health. For example, if I have to migrate due to war from a particular country, you can imagine what the mental status of the person will be. Also, the migratory process, they have to travel, the mode of traveling, people traveling by sea, people traveling by air, what they have to face as they travel. This also constitutes a form of stress to people post-migratory process, that is the acculturation, what they need to go through to settle into this new environment, the documentation process. These are stressful. And if you remember what we said in defining mental health, ability to cope and adapt to life stresses, normal life stresses. Some people are not able to cope with these normal life stresses, socioeconomic situation that they face, like we said. All right. Now, migration and impact. All stages of migration cause stress. Certain reasons for migration are stressful too. Traumatic factors are also contributing to the migration. So let me quickly talk about the science of stress. Next slide, sir. In stress, when we encounter stress, it activates the catecholamines, and these neurotransmitters are released into our system, the noradrenaline, dopamine, and serotonin. When these are triggers, they are, next slide, sir. With stress triggers the HPA, that is the hypothalamus pituitary axis. And when this happens, you will see with chronic stress, it reduces the TSH, that's the thyroid stimulating hormone, where it reduces the growth releasing hormone. And so reproductive function in the person is reduced, which means the person has a tendency of having difficulties achieving pregnancy or fathering a child. But the most important one is the cortisol level, which is very high, and the catecholamines. The catecholamines are the neurotransmitters I mentioned to us the other time. So what happens, next slide, with this stress response? What happens is the person starts having depression with increased catecholamines. There is depression, there is anxiety disorders. With increased catecholamines, there is insulin insensitivity. So the person has a tendency of having diabetes and hypertension, which are basic things that we experience when we are faced with stress. Like we said, migrants usually encounter cumulative stress. What are the common mental disorders that migrants face? They have depression. Depression is a mood disorder that occurs when we are faced with life stresses, apart from having a family history of depression. In this situation, the person have low mood, feeling of hopelessness, feeling of worthlessness. And if you remember, when we discussed mourning the other time, we said at that time, the person start having hopelessness, feeling of worthlessness, they have despair, which is also experience in depression. Person with depression feel low, they lose interest in previously pleasurable activities, they start having suicidal thoughts, they hear voices that other people cannot hear, they believe people want to harm them, and they have strong delusion of guilt. Anxiety disorders. Anxiety disorders are experienced when someone starts having fear of the unknown. Then they start having poor concentration. They start having issues with sleep. Adjustment disorders. These are situations where people have problems adjusting to the new environment. And as a result, they become irritable. They have symptoms that are similar to anxiety disorders and depression. Post-traumatic stress disorders. These stem from where they are coming from, especially if they are coming from a war-dominated zone. They start having issues adjusting to this new environment. They re-experience what they encountered in the war zone. They start avoiding the situation, etc. Then substance use disorders. A lot of people use substance to medicate these symptoms, to cope with this new environment where they found themselves. Okay, next slide, sir. Now, next slide. Next slide, sir. All right. The biological factors are, like I said, the family history of mental illness, and the psychological factors are personality disorders. We all have different personalities. Some people have personalities that they can bounce back. They are tough. Meanwhile, some succumb to life stresses. We have something that we call anxious personalities. So when someone has a personality disorder, adjusting to a new environment becomes a big issue for them. Perceived discrimination, past life experiences, abuse of different kind can actually predispose migrants in their new country to having a mental disorder. Social factors like having issues integrating themselves into a new environment, having issues with acculturation, having issues with social support. Now, a lot of migrants, when they get to a new environment, they tend to gravitate towards people from their native country. But in a situation whereby you can't find people of your own culture, it brings a lot of problems, psychological stress to the individual, racism, identity, where the individual cannot find their bearing. They can't define who they are in a new setting. As a result of this, it brings a lot of psychological disorder, and some people break down to this stress. Social influence. Now, social influence talks about having this relationship with your reference group. It could be people from your native country, but imagine if that is not found. It causes a lot of discrepancy in being able to settle down in a new environment. Social support is being found to be a significant factor in helping our mental health. If you find out that you don't enjoy that, it brings a lot of issue, where it is when you have, when you can actually identify that you have emotional support, instrumental support, which can be financial, and also appraisal from others, informational, which is very, very important. You will agree with me, for some of us that are, for all of us that have traveled outside Nigeria or to other places, that information is very scarce. You don't have people that give you information freely. You need to sort for it. You need to seek for it. Even at a point, you are misled to taking wrong decision. Also, social integration. This involves the establishing ties with people around you. It gives people, migrants, sense of belonging. It gives them that attachment. It promotes self-esteem and self-worth, and it encourages companionship and sociability. But for migrants that are not able to establish this causes a lot of issues for them, and it leads to a major psychological breakdown.
Doc, you have, I'll give you 2 more minutes.
Okay, so let's quickly talk about acculturation. We are all aware of acculturation. Let me summarize what I want to say about acculturation. Acculturation talks about you settling into a new environment. So with acculturation, it talks about the existence of new culture, new ethnic, new national identity, and so therefore we have behavioral, cultural, and psychological changes that are attached to acculturation. Next slide. So with acculturation, acculturation actually negatively impacts the family. It affects the couple, it affects the children, it affects them economically too. Now for the children find it difficult to, let me start with the parents. Parents are able to bring their culture. Some parents are able to bring their culture into their new country. Now, when they bring that, they are able to balance as they enter into a new country. But for the children, it's very difficult for them. They tend to settle in faster than their parents. And as a result, it gives them this discrepancy. There's this conflict in between, should I settle in for my parents' culture, or should I just go along with this new culture? So as a result of that, and parents will want to make them, to instill in them the culture, their native culture. This causes a lot of conflict in the family. It causes a lot of issues among the parents. So children tend to gravitate towards their friends. They listen more to their friends, and as a result of that, a lot of them fall into bad hands. They go into drugs and all that, and that causes a lot of psychological problem in the family. So there's problem with integration, with assimilation, separation, and marginalization. These are various platforms whereby people settle into the new culture. Okay? All right.
So you can try and round up, man.
Okay, sir. So, well, I would say that in as much as migration is a pleasant experience, as it's giving a lot of people, a lot of migrant opportunities, it also has a lot of psychological impact on people. So I will advise everybody that wants to migrate to consider all these situations and encourage and settle into their new environment. I will also encourage them to seek help when they have difficulties settling into their new environment. Migration is inevitable. It comes with good and bad. Therefore, comprehensive preparation is mandatory, bearing in mind that our mental health before and while making such decision is a holistic approach for maximum benefits. Thank you.
Thank you very much, Dr. Fasseson. Thank you, despite the glitches and technical issues. First and foremost, I was thinking of another title for the presentation. That is one, bringing in the global context that you have, or contextualization that you have presented. My own take is also that you can share with us case studies to really make it a reality. So I've asked participants to kindly indicate, and I will call on Professor Abdallah Uba Adamu, who indicated, and so that he can take a leave if we did not finish by 12, but we will round up 12 noon.
Thank you. Thank you very much. Thank you very much. Congratulations, Dr. Pasisan, because you have given this in a new perspective that so far we have not had an opportunity to listen to. Like the coordinator said, my only observation is that we would have been more enriched if you had given us specific case studies, examples of adjustments, of mental adjustment, mental issues, mental problems that people who are in a new society face. Not only just a question of mental, but depression. I mean, you go there, for instance, and in the fall, in November, by November, it has become dark and you start sleeping, only to wake up at about 10 o'clock or so, and then realize that that is when you should be sleeping. I mean, all this disorientation and things like that, I would have thought that you could emphasize some of these issues and also bring in this issue of culture shock that people bring with them. I lived in San Francisco area, and I know a Nigerian family that had an issue with their child. They were beating the child. They are from the Southwest. They were beating the child to discipline him. And the child reported them to the police, and the parents were arrested, and the child was taken away from them. So I would have thought that you would have given us living case studies of this kind of maladjustments as a result of being, an immigrant. So my suggestion is that if you are improving the paper, you need to inject it with specific case studies, either from a literature review or from your own perspective, from your own experience. But then you have to determine whether you are a migrant. I mean, you went to London and studied, or you went to America and studied. Are you a migrant or just simply a visitor? So again, those conceptual issues are there. So thank you very much. I think you have given it a new perspective, and I like your background. You're talking about a brain, we're dealing with mental issues, so that's very good. Unfortunately, I have to rush to a council meeting right now, but well done. You have given us a new perspective, but I would have thought that you will expand it and include real life case studies like the coordinator said. Thank you very much and good luck.
Thank you, sir. Thank you very much. And I believe she will, take this into consideration, because we would like to consider your paper for peer review and publication. The maiden edition is going to be out. We've been getting positive peer review from our international colleagues that are on the editorial board. And by the way, Professor Emeritus Sogolo is the editor-in-chief, and the journal is international. So really, you have to integrate some of what the VC said. As he was talking, I remember between 94 and 97 at SOAS, University of London, August, September was so strange for me because we have doctoral seminars. And then before you know it, 4 o'clock, it's dark. 4 p.m. is dark, snow all over the streets of London. And it was a cultural shock. But as a temporary migrant for educational purpose, I will listen to the next comment from Professor Emeritus Sogolo, And if you have a comment, please kindly let me know. We will stop at exactly 12 noon. Prof, sir, you can go ahead.
Thank you very much, moderator. First of all, I want to congratulate the presenter for giving such a stimulating lecture, because the very topic, touches on the life of everybody. We're talking about mental health, really. We're talking about something that will touch on each and every one of us. And naturally, when you migrate, the tendency towards, mental instability, seems to increase. Now, the thing that makes the topic, very interesting, which the lecturer has really touched upon, is that the concept is so elastic that, you sometimes ask yourself, am I really mentally healthy? You ask yourself, even though when you give the impression that you are healthy, then you begin to say, now what exactly is that state of being mentally healthy? You find that very often when you're thrown into a difficult situation, you begin to behave rather naturally, and it's so easy for anybody to think that you're not psychologically all right. Let me use the word psychologically. Otherwise, the concept is so loose that most of us will fall into the trap every now and then. But the presenter has taken it much more seriously. It's a professional in the area, and the question that I ask is this: when do you really declare somebody as being mentally ill? And
Thank you, sir.
Yes, when do you declare somebody as being mentally healthy? Thank you very much.
Thank you very much, sir. We'll take next Dr. Gloria Aneto. I've asked you to unmute, ma'am.
Yeah. Yes, I've unmuted, sir. Thank you very much, sir. I also want to join my voice to the voices of my senior colleagues to congratulate Dr. Fashe's son and thank her very much for sharing her paper with us, her knowledge with us. My Oga, sir, Professor Hakim, you know that I have never met Dr. Fashe's son. So I'm really very delighted that she honored my invitation without me even knowing her. I met her through a colleague, in quotes, okay. not physical meeting. So we are meeting now online for the first time. So I really appreciate you, Ma. And I want to say mental health is a topic that is evergreen. And like Prof. Sogolo was saying, to delineate between being healthy mentally and not being mentally healthy. It's a very thin line between the two. And every time, like we always say, all of us have 5 minutes of madness in us, like we say in the medical land, that every individual has some 5 minutes of derailing from the perfect mental health. I want to thank you. I want to give all that the medical profession the opportunity to ask questions. Mine is just to say thank you very much. I appreciate you.
Thank you very much, Dr. Aneto, for introducing her, and then the previous speaker last week, and I believe 2 more that you did. Dr. Aneto is a senior fellow of the Center of Excellence in Migration and Global Studies. We really appreciate you. I cannot see any other hands up. At this point, Dr. Fasesson, can you respond, ma'am? We have 5 minutes to round up. Thank you.
Thank you, sir. Thank you for the question. Thank you, Professor Sogolo, Mr. Aneto, and Professor Hakim, and all the participants. So I would have loved to share a lot of experiences. For example, I had to help a friend who relocated to US. And on getting there, suddenly one day the lady brought a friend home, and they were going to sleep in the same house with her. That's her boyfriend. My friend went into frenzy. She was running, almost going into shock, because this is something she had never experienced before. And then one day, the lady came to tell her one day that, okay, we are moving in together. She was almost going to go into epileptic because of that. And then I had to calm her down and tell her that, you know what? She is not an African. She's an American. You are the African. And I had to sort her out. You know, we discussed this thing at length, and that helped her to help the situation. There are a lot of case studies to that. I guess next time I would have to improve on that. Okay, when do we declare someone to be mentally healthy? From the discussion, from the definition, WHO defined mental health to be a situation where we know our capability. Every one of us must know our limits. You want to know what you can take, what you cannot take. Then it is that time that period that you know you can work productively and you can work fruitfully. And also you are able to cope with normal life stresses. And finally, you can contribute positively to people in your community. So let me just conclude by saying that for me or anyone to say that we are mentally healthy, that means I'm able to cope with life adversities. I'm able to bounce back. That is my resilience. Then that means I'm able to work productively. I can contribute to my community. Then I know when I have to stop, when to tell myself to stop. You can't go further than this. But before we say someone has a mental illness, there is abnormality. The person must have some certain, manifest some features, which include behavioral abnormalities, which almost all of us know about. The moment you see someone behaving abnormally, then it's also manifest in the way the person talks. Irrational talks, irrelevant talks, speaking out of points, being verbose, and also paucity of thought when the person cannot communicate appropriately. Also, the mood, affectation of mood, which can be related, undue elation or low mood. Undue low mood because there's nothing that is supposed to cause the person to have any form of sadness, but the person is just sad. Also, being happy for no reason is also part of the symptom that someone with mental disorders can present with. Perceptual disturbances, for example, hearing things other people cannot hear, seeing things other people cannot see, and also thought problem. Thoughts is actually, we can assess our thoughts through what the person is saying. So we say that speech is externalized thoughts. So you can have access to the thoughts of the person. And so if the speech is increased, that means the thought will be racing. If the speech is, there's paucity of speech, that means that the person will be blank within themselves. Then we can also talk about thoughts, abnormalities. The content of thoughts can be abnormal. For example, the person can start having thoughts that people want to kill or harm him, or having the thoughts that they talk about him on the TV, or the person feels that they are no longer in control of their thoughts. So, so many things. The person can be apprehensive, but we will all agree that at some point in time, we experience some of these symptoms. But before I can say this person is my patient, it means that the symptoms has affected their functioning. So there is deterioration in functioning, and it has also affected their interpersonal relationship. That means the person that is a high flyer suddenly drops down the ladder, or someone that is a friendly person suddenly start having issues here and there with people. Also their job, they start losing job, they start losing friends, and so many other things too.
Okay, thank you very much. I'm going to read a comment in the chat room, privately sent to me. The person has been saved by the fact that we are 12 known. It is a good comment. It says thus: I suggest the presenter should work on the structure of the paper. Most times, the flow of discussion is punctuated with too much conceptual clarifications. So as you review, you may want to take that into consideration. We would love to have your paper, man. we will surely would love to have it published in our international journal. I believe all of us can see what I'm projecting. I've also posted this in, on WhatsApp group and the Telegram group and NOUN News. If you don't have it, just send me an email, CEMGS@noun.edu.ng, and then we will forward to you. Again, I thank you very much, Dr. Faseson, for presenting and sharing your intellectual property with us. Knowledge shared is knowledge gained, and we appreciate you, man. We look forward to a lifelong relationship in terms of even Babcock as an institution and the National Open University of Nigeria. Let me thank also all participants today for finding the time to join us, despite the NSAS situation, the situation that is becoming so ugly, so unfortunate. I thank all of you also for leaving that e-exam to join us. For some of us, that was supposed to be monitoring, we really appreciate you. Again, be safe, observe COVID-19 protocols, as Dr. Yebode is doing even in his office, although he's putting it in his shame. But when you go out, when you see people speaking, try to, encourage them to use it because it is real. Thank you. Thank you. God bless all of you. We meet again next week when we will be listening to a professor from University of Ife. I believe it's not Dr. Yeah, I believe it's the professor from University of Ife presenting and then sharing knowledge with us. I thank you all. And bye-bye.
Thank you. Thank you, sir.
Bye-bye.
Thank you, sir.